Good evening, everyone. I'm Jocelyn with South Carolina Hands and Voices, and we have Lisa Jolly on with Beginnings SC and our panelists for today. And I want to welcome you this evening at 7 o'clock on a beautiful day, and at least in Columbia, South Carolina, where I am. And we want to be good stewards of your time and get you started with Topic Tuesday for Ask the Audiologist. Just want to take a second to give a brief overview. I'm excited because both of these audiologists that are the panelist speakers today are members of our South Carolina Hands and Voices board, and they come with a wealth of knowledge. And if you happen to subscribe to Hands and Voices and our newsletter, then these are the two lovely ladies with a wealth of information who have been doing our monthly Audiology Corner newsletter that Hands and Voices puts out monthly. So they're coming as the audiologists. Hopefully you've have thought about some questions and we can get into those. But before I turn it over to them for their presentation, I wanted to give you a little bit of background about them because I can't brag enough about them. Maria Hetlinger is a practicing pediatric audiologist for over 17 years. She received her bachelor's and her master's degree, and she practiced clinically before getting her doctorate degree in audiology. She used to be up in the Philadelphia area working and had a career with the Children's Hospital of Philadelphia, where she had 11 years there. And she worked on a team as a senior pediatric audiologist and a member of the cleft palate and craniofacial multidisciplinary team. We're excited because in 2013, she actually moved to Columbia, South Carolina, and has been a resource for so many families. She worked in private practice first at pediatric ENT and audiology setting. And then in 2015, she started working as an educational audiologist at Richland II School District. And she's very passionate about what she does and feels that through the various work settings and experiences, she can help provide support and information from the clinical and educational perspective to families and children with hearing loss throughout their journey. So we're excited to have her, and she's been awesome on the board and the information she's shared. The other one I can't brag enough about is Laura Stone, and she's actually in the Charleston area, and she's as well as educational audiologist for the Charleston County School District for 11 years. And she's gone through and obtained her undergraduate degree in communication disorders from the University of Mississippi. She went on for a master's in audiology. And she's always had a focus on pediatric audiology and did her clinical audiologist for about 2 years. And then she took an opportunity to work at Anchorage School District in Arkansas. So both of these ladies have been all over. And then they decided to come back and relocate here. And she realized too her passion and where she needed to be and assist in advocating and understanding individual needs of children that are deaf and hard of hearing. So I'm not going to delay you any further. We're going to turn it over to them and they're going to speak. And then after they go through their presentation, if you want to, in the chat box, and we'll have a segment to unmute and we can get into the questions that you have. So I'll turn it over to Laura to get started with the presentation. And thank you for joining.
Thank you, Jocelyn. Just going to wait for our slideshow. I'm Laura Stone, as Jocelyn said. I'm the educational audiologist for Charleston County School District. I'm really excited to be here tonight to talk about conversations to have with your audiologist, whether it's you have an educational audiologist or a private audiologist, just things that you may not have thought of to discuss with your audiologist or may think aren't relevant, and just covering all topics. You will see a theme throughout the presentation that basically is communicating with your audiologist. So I'll start with my first slide that touches on medical discussions with your audiologist. So the basics, and we're just as guilty of going through our routine and making those appointments, routine appointments with the same conversations. You know, we constantly will have X and O, and we'll say it's a mild hearing loss, moderate hearing loss, severe, conductive sensorial mixed. And I know those aren't always terms that hit home to you or actually make sense sometimes. And making sure that you take that time to also stop us and make us stop and actually explain what that means. What does that mean in your everyday life? What does that mean for access with your child? And I know those first few appointments can probably be a little bit overwhelming, especially if you didn't know hearing loss was going to be a possibility with your child. And so even if you've been with that audiologist for 2 years, don't think you've missed the point on finally having those conversations and saying, okay, what does that mean? You know, what can my child hear? What does moderate hearing loss mean? And I've had parents that want to get in the booth and they hear those sounds in the booth, and it is mind-blowing for them to actually hear what their child's hearing, or hear how loud that sound has to be, or hear those word discrimination scores and how their child is able to respond to certain speech sounds. And so don't be shy. Have those conversations with your audiologist. If you're really fortunate, you're going to have the same audiologist as your child grows and goes through many milestones in life. And so this person needs to be a really close factor in those milestones. If your child is diagnosed with hearing loss, you're going to be referred to an ENT, who most of the time will probably call or recommend some form of imaging. And through that, that's just trying to find out maybe a possibility of the cause of the hearing loss. And if there is a cause, make sure you ask all those questions. Make sure you understand if there are going to be other symptoms associated with that, or will there be a likelihood of a progressive hearing loss, or are there limitations in day-to-day activities, or what to expect by that diagnosis. Again, just don't be shy and making sure you ask all those questions. And if there are any new medical conditions that happen in between appointments, don't feel that that they're not relevant. I have lots of parents, I had one yesterday actually tell me, I'm sorry, I just gave you too much information. And there is no such thing as too much information. We want to know everything. We want to be a big factor. And there are many things that can be relevant that will maximize those appointments and those discussions with your audiologist. The next slide covers educational discussions. Obviously, that's really close to home for me. That's what I do, but those are really important things to have with your audiologist from day one. And educational can be any setting. Don't think your child's too young to start having those conversations. Daycare settings, preschool settings, talk about services, even through BabyNet or early intervention that your child may be getting. What does your child's everyday look like? What environmental sounds are they associated with? What language growth opportunities are you looking at? And if your child's in at school age, it's been a year. So, these were conversations we should have had already, but making sure even now it's even more crucial. There are new settings, there are new hurdles in schools. So, we have face-to-face and hybrid and virtual and all the new terminology that we were not dealing with before. So it's even more important to have those conversations and talk about whether your child has an IEP or a 504. And if your child does have that, what services are being provided? Is there a speech pathologist? Is OT, PT? Is there a teacher of the deaf? Is it just gen ed? And when you have that information, making sure that, again, it doesn't have to be an educational audiologist. This can be your private audiologist, and making sure that those conversations with the team are happening with the private audiologist, giving that permission. There have been a lot of times that I've had students that have gotten new amplification or had a change in their hearing loss, and it wasn't immediately relayed to me or the school team. And those are important factors in that educational planning for all team members, not just team members that may be associated with any form of hearing loss. And the next slide talks about other areas for educational discussions, and accommodations are going to be individualized. That is something that is going to be different for every child, depending on the individual needs of your child. Again, I talk, the new COVID restrictions, there are a lot of hurdles now. There's masks and there's plexiglass and there's extra distancing. So just making sure that you have that conversation with the school team and your audiologist on what does that mean and what could we look at for that. I threw clear masks on here only because I just we've learned a lot over the last year, but I'm still having some discussions about them. And in the beginning of the year, I think we didn't know what to expect when school started, and everyone immediately recommended, clear masks for all of our deaf and hard of hearing students. And that made sense because you could see your lips. But we quickly realized through research and also just day-to-day experiences that it is very individualized based on the student and their communication needs. So the clear masks do not sound clear. You're definitely taking away that audibility by providing visibility. So it doesn't work for every student. So we actually had one of our kindergarten students. I was very excited because he was advocating for himself, but he asked our teacher of the deaf to take the clear mask off and put the surgical mask back on because he could not hear her as clearly. So just realizing that all accommodations, it's not a one fit all situation, it's individualized, and making sure that you look at what specifically works for your child in those settings and have that conversation with your audiologist. So there are specifics to preferential seating, captions, that kind of thing. And would that access be available? For academic performance, it's good to have the conversations pre-COVID. I think it's even more important now. Have there been any changes in the academic performance? Is there a specific subject area that you're now seeing your child have more difficulty in? And those are conversations that, again, can be linked with the team and your audiologist to see how can we put all information together, all specialized fields, and make the most educated decision out of that. So, and the next slide is going to be for technology. So it's come a long way, and we have all gotten more savvy in technology over the past year. I know I have learned a lot over that, but even with just hearing aids or amplification, that even pre-COVID, that changes frequently. I feel like there have been a lot of upgrades over the last year. This goes back to really understanding the hearing loss for your child. That way you can have a better choice of deciding, are hearing aids better? Would a Baha be better if you're choosing amplification or a cochlear implant based on your child's hearing loss and your child's access? And I attended the pediatric audiology conference at MUSC a few weeks ago, and they talked about the eligibility criteria for cochlear implants and Bahas and some changes and some new eligibility criteria that have taken place. And it is constantly evolving. So, stay on top of your appointments with your audiologist. Make sure that you continue to make those annual appointments. That way, if there's been any changes with the hearing loss or any updates with eligibility or amplification options for your child. And it does get overwhelming. Once you make that decision, then you would have to make a decision on what brand or what company do you choose. There's 3 with cochlear implants, there's 2 with Bahas, and there's many with hearing aids. So it gets really overwhelming, and it's not something that you would have to decide at one appointment, but just making sure that you educate yourself too, because you are an advocate for your child, and hopefully as your child gets older, they become an advocate too, but you're a team member in those decisions, and making sure you're an active team member with those decisions. And when you make that, then it crosses over to school. Those are questions to ask. What accessories could be there at school? What are options with school-based? If you chose amplification, there's potential FM or DM options if that's something that your child requires. The classroom audio distribution system is just a really long way of saying sound field in the classroom. So just a microphone usually in the classroom. Would that be something that could be helpful? There are lots of apps and online programs that are now there. There are headphone options. There's super oral headphones that can go over hearing aids so they won't squeal. There are bone conduction headphones. The list goes on, and making sure that you have those discussions too. It's all relevant. For the next slide, the last one would be for at home or everyday use. Those are the big questions too. How does this cross over to restaurants, or when I'm riding in a car, or just everyday activities? So again, there's apps that are there. There are microphones that you can wear in the car, and then there's access to TVs or computers, iPads. I had a meeting yesterday with a student who had cochlear implants, and he hasn't really stayed on top of his appointments, and they hadn't been to an appointment in a while. And his mom didn't even know Bluetooth was an option, to go and have those discussions about new technology and ways he's struggling some at home with hearing the TV and the computer and the iPads. And those were just conversations that I definitely relate to them to have with their private audiologist. So the main focus is just nothing's not relevant. Everything is relevant. Have those conversations with your audiologist and just make sure you're as educated as you can be on all options. So that concludes my portion. I'll turn it over to Maria for the rest of it.
Unmute yourself.
Okay, there we go. The fun parts of technology. Thanks so much, Laura and Jocelyn. It's really great to be here tonight. As we look at my first slide, the object that I have on the screen is a compass. When your child's first identified with hearing loss, you may feel you're in uncharted waters. The topic of discussion tonight will allow you to know you're not alone in navigating this. Building a strong relationship with your audiologist is very important. You want to make sure you're making the most of your visit, and he or she needs to be aware of things you're doing or feeling outside the office. The first area is acceptance of hearing loss. You're not alone, and there are others as well as amazing resources that are available. Ask your audiologist about support groups. So here in South Carolina, we have SC Hands and Voices, Beginnings, and AG Bell. They have parent groups, child groups, and wonderful resources. Discuss any feelings you or your child or family members may be experiencing about the hearing loss. This is really normal. Many parents experience grief or disbelief or just want some more information, and that's fine to do. I often have patients come in and say that their hearing's cured or it's normal now when it isn't. So even the child's going through sometimes a hard time accepting their hearing loss, and this again is a normal thing. Let your audiologist know about these feelings so you can discuss them and be given advice and resources. Ask about options that may be available for your child in his or her hearing care. So, picking out fun color ear molds, their favorite sports team colors for their ear molds or their favorite color hearing device. That really does make a difference for your child. If the appointment has a whole bunch of tests that are going to be done, ask if your child can choose the test order. Sometimes this may not always be the case, but giving your child the freedom or saying the process really helps with sometimes accepting the situation that they might not always want to be there, but if they have some choice to say what order they want to do it in, does help. Ask if there are books about hearing loss. There are books with characters who have hearing loss, like El Defo. It's a graphic novel written by C.C. Bell, who is a person with hearing loss, and she writes about her different experiences. Our teachers of the deaf in our district read this book with a lot of our students, and they just had some great conversations with it. Ask if there's names of famous people or professionals with hearing loss. Bill Clinton, our former US president, or Derek Coleman, an NFL player, both have hearing loss. It's nice to show that these people were able to be successful and accomplish great things. Just like Me Dolls, there are several companies that have dolls that have hearing aids and cochlear implants. Even Signing Works has a signing bunny, which allows you to manipulate the fingers of a bunny into ASL signs. And just having a Just Like Me doll can increase their self-esteem as well as provide lots of fun. I used to have patients come into the office bringing their doll along whenever they had the appointment, and it was just kind of the doll and the patient had their appointment together. It was nice, but it was something just to really help with that acceptance. Next slide, please. Okay. Isolation or feeling like you're the only one is a common feeling for children with hearing loss. Ask your audiologist if you can meet other children. Oh, my dog's barking. Sorry if you hear it in the background. He or she can often make patient-peer connections. That, of course, is with parent permission. But I had a lot of success doing that when I was doing private practice. And a lot of kids just developed some wonderful relationships and friendships along that. Ask if there's any camps for children with hearing loss. Here in South Carolina, we have Camp Sertoma, Camp Wonder Hands. Some local hospitals like MUSC sometimes have camps, and AG Bell has the LOFT program for teens. We've had students attend these camps and they've all gotten rave reviews, just great events, and they can't wait to go back each year. Are there local support groups having activities? These are great social events for your child to meet other children with hearing loss. Even right now with COVID, there's virtual events taking place, just like tonight. But I've been able to attend a couple of the South Carolina Hands and Voices virtual paint and sit events, and they've been really fun. And it's great to see the kids and parents interacting with each other. Does my child's hearing aid or cochlear implant manufacturer have support services? Phonak has a website called Hear Like Me, and it has all kinds of articles, stories, and world information regarding to hearing loss. So it's like I pop on there pretty frequently, and there's some really great articles. Connect with Us by Cochlear will help connect you with other individuals to share their journey. So you can say where you live, and they can try to connect you with another family as well. It's a really great resource. Next slide, please. Talk about different emotions your child shows in situations. This can be success stories or when it was really challenging. Discussing this with your audiologist can lead to different areas of discussion. So he or she may want to alter a program in the device or offer suggestions or strategies or communication strategies. It might even turn into a high five for your child, like the times that they really did an awesome job of advocating for themselves or talking or speaking up for themselves. Times that you're just like, wow, you did a really great job with that. Ask about communication tips at home. So dinner time or like when you're in another room. Dinner time is really important for family communication. So it may be suggested that turn taking be put into place to ensure that one person's speaking at a time, which makes it a lot easier to hear. Discuss times when you had communication breakdowns. Was it in your car or out at a store? Sometimes assistive technology like an FM system may be recommended. So there's going to be times that they might say, you know what, that might be a better time because the car is one of the more challenging situations to be hearing in. Report times when you notice your child having challenges. This could lead again to new programming or counseling on how to handle it when or if it does happen again. Talk about situations your child may try to avoid and discuss strategies to assist your child. So, sometimes it can be personality related, but sometimes it really can be due to those difficulties. So you want to talk about ways to assist your child so they're not missing out on opportunities. Talk about self-advocacy skills and how to work on them with your child. And that's a very big part. Next slide, please. Talk about what sports your child may be interested in or play. Questions like, will I need a dehumidifier for your hearing aid or cochlear implants? Good to ask because we all know moisture is the device's worst enemy. So most likely the answer is going to be yes. But this is also just informing your audiology of activities that your child's involved in, as well as just being proactive to prevent any problems that could be happening to the device. Should my child use special protective equipment? There's special helmets for football, baseball, softball, and lacrosse with padding that allows for hearing aids or cochlear implant to be used, to be worn. And you can ask your audiologist to assist you with getting this information on the different companies. What strategies are best for communicating during practices and games? A lot of times it depends on the sport, but visual cues are usually best to have in place. And a lot of times a buddy system can be helpful. Can my child use an FM system while playing sports? FM systems can definitely be used during practice, but not usually during games due to regulations. However, if it is a school-related sport, the governing body of athletics in the state needs to issue a letter stating the accommodations allowed. And then at that time, the coach will have to, bring that letter from event to event. But it is allowed to be done if it is a school-related sport. How can I find out about special rules for sports and hearing loss? There's an amazing resource called Timeout, I Can't Hear You. I use it all the time. It's an 88-page document with rules running from archery to table tennis. But if you have a question, usually the answer is in there. What should I tell the coach about hearing loss? It's important to inform the coach about hearing loss to ensure he or she is communicating effectively with your child, make sure they're using good visual cues, and also just for safety purposes. Next slide, please. So, Discuss what activities your child's involved in. This is great with informing your audiologist of just your interests, just having that, just knowing what you're doing outside. It can spark a lot of great dialogue. So questions like, where's the best location for my child to be during instruction? An activity that I often got asked about was dance class. So when we would talk about it, I'd say, well, you don't want your child to be right next to the speaker. You don't want your child to be in the far corner. So you want to be in a location closer to the front with really good access, visual access, because with dance, you think about the moves and all of that, of being able to mimic that, but they need really good visual access. So just talking about those components and ways that they can talk with their instructor is important. Again, what do you talk about with the activity leader? Very similar to what I talked about with sports coaches, but you want to make sure, to inform them if your child has a better hearing ear. So you want them to be positioned in a place that they're going to have better access. Visuals are really helpful. Instruction clarification to make sure your child understands what they need to be doing. And again, a buddy system is a really great idea or suggestion and helpful. When should my child wear hearing protection? So hearing aids have sound reduction and compression, and a lot of times they can be the protective factor with helping if there is extra loud noise exposure, but there are some times that your child might need to be wearing hearing protection if the event is too loud. Does my child need to wear his or her device during an activity? So the answer will usually be yes, but there are times that hearing aids or cochlear implants can't be worn. So one idea that comes to mind is water activities. So a lot of times during some camps and stuff, I remember that in the summer, parents would ask about that. And I say, if that's the case, you just always want to make sure you have an adult aware of the child's hearing loss. So like if they were doing swimming activities, the lifeguards and that, and then to make sure you have a really good visual system in place. But again, these are just really great questions and topics to discuss with your audiologist to, just to have that information. Finally, many times I was asked about hearing aid use during musical instruction. So it was often a case-by-case issue. So you just want to talk about what the instrument may be or what the different activity would be regarding the music. And you just have to, sometimes feel it out. But a lot of times, hearing aids have music programs in them. So that might even, again, just be an adjustment that simply needs to be made by your audiologist. So I know I went through that pretty fast, but I know we covered a lot of information tonight, and I hope just everything that Laura and I talked about will just help trigger some really great discussion amongst you and your audiologist. But the relationship between you and your audiologist is really important. So you always want to make the most of your time. So when you go in there, talk about what you're doing in your daily life, concerns, feelings, activities, and questions that you have to make the most of the visit. Thank you so much.
Yay, ladies. Thank you so much for that information.